Hi there, and welcome to Canceling COVID. Thanks for tuning in. We meet every Tuesday to just update you and keep you informed about what's happening in our community. We call it Real Talk, Real Resources, and just a way to keep you updated as we certainly have gotten very comfortable and confident about where we are with COVID, and we still have so much work to do. Now, we've been hearing a lot about mental health and mental fitness. Shout out to all of the mental health and mental fitness experts out there working really hard. And we know that this is going to be an issue that we'll be dealing with for quite some time. So I've got Dr. Tracia Black, who is expected to join me she joins us every Tuesday. Groundwater Solutions. Actually, I believe someone else is filling in for her today. I want to start by saying thank you to our sponsors, which is Groundwater Solutions, as we put their information up for you. Again, Groundwater Solutions, if you need to get in touch with them, groundwater-solutions.org, 704-596-0505. And also our support from Mecklenburg County Public Health, mecnc.gov, 980-314-9400, 980-314-9400. Just a couple of updates as we continue to keep you informed as we wait for our guests from Groundwater Solutions to hop on. Mental fitness is what we're talking about today. I don't know if you recall, my good friend Tracy Austin was on talking about brain mapping and things along those lines. And I've been posting, did an article about suicide prevention. Let's talk about it, not just when there's a celebrity involved, but let's make it therapy a part of our everyday conversation as well. In addition to that, there are a lot of ways that we can start incorporating this into our daily lives, just talking about mental health and the comment or that person's crazy or this person. Surely, truly, there may be something going on with them, and we need to pay more attention. Just be more attentive and conversational about the need that is there. Just a couple of updates before we hop into that. Pfizer has requested authorization for its vaccine for children under 5. That's right. They've already requested authorization, and I believe that came down last week. The vaccination would eventually be 3 doses for young children because right now, under 5, apparently not able to get those doses, but Pfizer has requested approval. Also last week, not last week, starting this week, you've got an opportunity to pick up free at-home COVID tests. And shout out to Mecklenburg County Public Health. You can pick them up at libraries, Charlotte Mecklenburg libraries all around the county, and you can pick them up at the location on Billingsley Road for Mecklenburg County Public Health. Now, the hours are 10 until 7. They're available via curbside pickup, so no ID or insurance is required. And this is while supplies last. You'll get a maximum of 4 test kits per household, and you don't need a prescription or anything like that. None of that's required. Just pull up and say, hey, I need my test, because we want to get in the habit, especially of having these at home, and so that they'll cut down on people needing or heading out. Although I know that things are starting to die down. Here we are at this point again, and we're going to talk about that in just a moment. But just want to make sure that you're picking up your free COVID tests that are being made available to you. I got mine in the mail. It's been over a week now, and they're sitting here. If I need to use them, certainly it's great to have that resource. Here's the thing. Too many people are still going to the emergency room, and that's not the place for you to go. Clearly, they've got other emergencies to attend to. In addition to that, that can end up being very costly for you. So if you haven't gotten yours yet from the government, head on out to one of the libraries. But I would say go to the website because it's different times at different locations, but it's all around the county. In addition to that, there is the whole issue of flu season, which is upon us. So if you've got your test there, then you can have a pretty good idea of whether you're dealing with COVID or whether this is a situation where you're testing or you're ill with something else, I guess is the best way to put it. Also, you can lessen the risk or the symptoms of COVID-19 and reduce your chances of being hospitalized by 90%, according to this new pill that's available. I love to see you guys. I see you're on board. Hop in the chat and tell me your thoughts. Hey, Catrice, I see you've hopped on. Thanks for joining us. You know, there's a new viral pill now, or a pill available for COVID-19. 90% of approval rate or chance of reducing your risk. And it's designed to treat the virus. So if you have mild and moderate symptoms, and you can sign up for a cost-free virtual visit or get some information. There's some outlets around the area now that are providing that. And when I say outlets, I certainly mean medical facilities. It's not like you can just pull up anywhere and grab these pills. With that said, I would encourage you to investigate that further. One of the things we talk about here is being able to offer alternatives. And I love your comments. Katri says, really, a pill? Yeah, they've got a pill now that's available. Just think how science continues to develop and how we've been able to get to the point where now, we're at the point where it's a pill. We're headed into our third year. We trust science and appreciate all the efforts that are being made. So, hey, just like taking an allergy pill, which I have to do every day pretty much, now there's a pill to treat that. We'll hear more about that as we get more experts on. We also, I said alternatives. If you saw what we're talking about, mental health and mental fitness, I've got a very special guest that's going to join us to talk more about another alternative to people that are looking to deal with anxiety, depression, insomnia, even pain and things along those lines. But now I'm going to bring on our guest. It's Earl Owens, who is stepping in for none other than Tracia Black, Groundwater Solutions. So good morning, and thank you for taking the time to join us.
Good morning. How is everybody?
Everybody's good. Everybody's good. Can you hear me okay?
Yep,
I
I
don't know
can
if
hear
it's
you.
my volume or your volume. So let me turn mine up and see. Okay. So you can hear me okay, though, right?
Yes, ma'am.
Okay, so let's check in and see what's going on with Groundwater Solutions. Dr. Black and I would meet every week about this time to kind of get a pulse on what's happening in the community. So kind of fill us in on, say, what's happening as far as testing. I do know the numbers are starting to drop. I was on a call yesterday. The numbers as far as cases, and I think we've all had it or someone's had it, but now the hospitalizations, they would like to see a lot lower as well. So kind of speak on what you guys are dealing with.
So, of course, we're starting to experience um, a downward trajectory of testing. So that's evident that a couple of components. We got, of course, COVID burnout.
Mm-hmm.
People are just sick of it,
I
right?
know.
Yeah,
I
yeah,
know.
yeah.
We all
So
are. Yeah.
right. So, and then, the confusing information that we continue to receive, from the news media, are we taking the mask off? Are we putting the mask on? Do we really need testing? And things of that nature. But I think that the more people are starting to get vaccinated, that's really, contributing to the decrease in the testing.
Mm-hmm.
So, with that being said, though, I feel like that the community should be aware that until we as a community all band together and get on the same page, everybody gets tested and boosted. That we're gonna have to live with COVID in some kind of way. It's just that the outcomes is what really matters in this equation, right? You know,
Right.
um, I know that I don't want any of my family members to die,
Right.
from something that can be prevented.
Mm-hmm. Mm-hmm.
And so, that's the position I believe that we take as not only as a company, but as human beings that care about other human beings.
So now
So
that your testing has died down, what are you guys filling up? Like, what is a typical day like now? Are you doing more vaccinations? Because I know at one point you guys were out and about around the city and around the state. So are people starting to at least get more vaccines?
right. So, and then also too, we're also headed towards, more rural areas, and places that do not readily have, availability and services such as,
Mm.
like Mecklenburg County, right?
Right.
Mecklenburg County, you can get a vaccine or a test practically anywhere.
Right.
But
Right.
so I think our next big move, we're going to Wilmington, North Carolina. And
Okay.
so so we're taking our mobile lab out there and we'll be testing and vaccinating. The unique thing about Groundwater Solutions is one thing that they do that most companies don't do, and this including the big box companies, is that we
Mm-hmm.
test our patient, vaccinate, test again. So
And
with
that's
that,
really important. Yeah, we talked about that before because it was discovered early on that if you have COVID, do not take the vaccine while you're, dealing with it. But, one of the things that we've also appreciate about Groundwater Solutions that you're out there on the ground level doing grassroots. Are you seeing a lot of children, more children coming in to get vaccinated?
Absolutely. So, and as the school year progresses, and now that the school year is on the downward, we'll be looking at what about August or no, maybe May, into May,
Yeah, by
June.
May. Yeah.
Yeah. So the kids are going to be getting out of school. So yeah, the parents, I can honestly say that I'm proud of the parents, that are
Good.
bringing their kids in and getting them vaccinated,
Uh-huh.
and getting them situated so they can prepare them, for hopefully a fulfilling, healthy summer.
Right, right. And that's the idea that we get to summertime and as time progresses and we applaud you all as well. We continue to improve and learn from our past and that's what it's about. One of the things that Dr. Black stresses is testing, testing, testing. She's always been a big advocate for that, but also not getting away from our mask and the physical distancing and the hand sanitizer. The physical distancing, yeah, that'll be a little tough, especially as we head into summertime and all of the outdoor activities, getting in the pools and things like that. I mean, that's summertime. But hand sanitizer, I think, is always something that you can keep with you. And clearly, I was on a call yesterday where the question was, at what point does Mecklenburg County lift the mask mandate? And a lot of states are doing that. The unfortunate part is we know there's another variant out there, and hopefully we don't get to the point where we did with Omicron, where, everything starts returning back to our new norm, and then we have to back up all over again. But thank goodness no one had to close. So, Groundwater Solutions, where are you guys out and about today?
So we're here at the office. So
Okay.
as you know,
On Reagan Drive.
yeah, so we 5104 Reagan Drive,
Uh-huh.
suites 3 through 5. And
Okay.
so we provide testing and vaccination daily, Monday through Friday, 9 to 4 Monday through Thursday, 9 to 1 on Fridays. And then we also stage events, throughout the state. And like I
Okay.
said, I think our next destination is going to be Wilmington, North Carolina. It's expected to be a very big turnout. So the team will probably be out there, for probably about at least a week.
Okay. Well, Groundwater Solutions, Mr. Owens, Earl Owens the third, taking the time to join us. If you need information about Groundwater Solutions, groundwater-solutions.org, groundwater-solutions.org, 704-596-0505. Real quick, are you guys still down in Union County as well, doing vaccines?
No, they actually
Fantastic.
closed that site due to the lack of numbers.
Okay.
So I think, and that often happens, when a community becomes saturated, and
Yeah.
again fatigue starts to set in, and
Uh-huh.
people are basically satisfied, with the results that they're receiving,
Mm-hmm.
then it becomes lesser and lesser of a need, of course, until it pops back up.
Right, right.
So
Well,
that's just the nature of the business. But the collateral consequences of COVID-19 has been the behavioral health and the mental wellness of the community, which our numbers have increased by 4.
well,
So
and go ahead. I didn't mean to interrupt you. Sorry about that.
no. So what that has done for our behavioral health side is really put a strain, on the agency as far as us being able to provide services for the community. So it's all hands on deck right now. We're over here wearing many hats, so I mean, I'm proud and happy that we're able to service the community, especially when it comes to dealing with behavioral health and
Huh?
and trying to prevent hospitalizations, and mental wellness episodes. So that's really important to us.
Well, thank you so much for taking the time to talk with us again, Earl Owens III. I'm smiling here. It's not because of what you're seeing, because when we go live, there are times where things are not where they're supposed to be. And that's what's kind of happening with me right now. And, you have to smile to make sure that to keep from it's just live. That's how it works. So thank you again for taking the time to join us. All
Oh, no
right.
problem. Thanks for
All
having me.
right. Absolutely. Groundwater Solutions, folks, we continue to bring you great information. I also want to highlight this report if you want to find out about the impact of COVID on low income households and communities in North Carolina. KeenanInstitute.unc.edu, KeenanInstitute.unc.edu. I also wanted to point out something that I received from Atrium Health that I thought was really, really kind of just really powerful. And I was trying to locate that. These are the results that clearly have been something that has impacted our community. Do that as you see me come back on the screen as we've been hearing a whole lot about it, and we had some guests lined up. Fonda Bryant, who is with NAMINC, she had last minute cancellation, not able to join us, but she's got a QCR suicide prevention session that's coming up. And certainly, hopefully, you'll get an opportunity to take it. It's absolutely free. You do it online, and it allows you to become qualified or at least have a better idea when it comes to identifying people who may be dealing with suicide or even thinking about it. And shout out to suicide prevention experts like Fonda Bryan and mental health experts. She is always available and willing to help and assist, and that's a really good thing. Talking about mental health, I saw this video that I thought was really powerful, and I'll run it a couple times. It's a minute, but it speaks to our community about dealing with mental health. So
African Americans have one of the highest rates of untreated mental health disorders among all racial groups. This is due to a long history of institutionalized racism and high levels of cultural stigma. For example, the belief that mental illness is seen as a weakness or spiritual flaw. This
and here
stigma
at
can
Canceling
prevent people
COVID,
from accessing the treatment they need to get better. Cultural considerations are important when developing treatments for this group. Many place high value on the church and religion as a coping tool and source of strength for problems, including mental health issues. Respected spiritual leaders can be harnessed to provide support for those with mental illness in their communities. When the leaders work collaboratively with mental health professionals, then there is a potential to provide mental health expertise in a culturally relevant context, creating fair access to proper mental health treatment.
looking for suggestions and ideas, great ways. We pride ourselves on real talk and real resources and real solutions and an alternative, an opportunity to hear some things you may not normally hear in mainstream, which is really when we got started. And canceling COVID has disrupted every aspect that you could imagine when it comes to our daily lives. And people love choices. We've had a difficult time, everyone, in making the adjustment, and rightly so. So our mental fitness, our mental health is so important. And I was able to meet someone, Mrs. Will Dees, and she is here to talk with us about an option, an alternative. And the title of it is called Alpha-Stim, but she's going to tell you a whole lot more because it's new to me as well. And I felt like we really need to share this information with everyone. So first of all, hello, and thank you for taking the time to talk with us, Mrs. Dees.
Hi, Tanya. Thank you for having me.
Absolutely. So let's just start by giving a little bit of background about you and how you've gotten involved with Alpha-Stim.
Okay. So from a career perspective, before I started with Alpha-Stim, I worked in healthcare IT product management for almost 20 years. And back in 2013, my then 11-year-old daughter started suffering with some chronic debilitating pain. And so we did a lot of things to try and address her issue. And unfortunately, we were not successful. Initially, she was taking medications that were giving her side effects. And again, she was young, so I was concerned about that as well, and the long-term effects of some of the things we were giving her. And so at some point, I just started researching as a mom, as moms do out of desperation, just started researching different things that we could do to help her get better. And so I found several things that could assist her, such as changing her diet, changing what she put on her body. We learned about acupuncture. We learned about neurofeedback therapy. I think you had a provider on the other day speaking about that. And then we also learned about Alpha-Stim. And so once we got our Alpha-Stim and I started playing around with it and using it with her and using it for my other family members, I was like, this thing is amazing. Why don't more people know about this? And so kind of one thing led to another. The company for which I worked got acquired by one of our competitors, which offered an opportunity for me to take a package to leave. And so I did that. And that gave me the kind of nudge to do that. I probably wouldn't have done that if that opportunity didn't exist. So it kind of gave me the nudge to step out and try something different.
And so tell us, with this new venture, what is Alpha-Stim? I think
so Alpha-Stim, I actually have it on now.
Okay.
So my light just went out. But Alpha-Stim is this little device here. It's an electrotherapy device. It's been around for about 40 years. It is FDA cleared to treat anxiety, insomnia, depression, and pain. And what you see here is I've got the cord connected to these ear clips that are attached to my ears.
And so how does it work? You just take that and you attach it, and electronically it tells you what to do. How often do you use it? What is required?
Yeah, so it's really simple. You don't really tell it what to do. So our bodies operate electrically. So our cells function electrically. And so what Alpha-Stim is doing is very gently tapping into our body's electrical system by stimulating nerve cells in the brain when we put the ear clips on. So we're talking really tiny amounts of electricity going in, working to normalize and to balance our central nervous system. And so when you do that, you typically feel more calm, more relaxed, but more alert as well. Treatments can last from 20 minutes to 60 minutes. When people first get started with Alpha-Stim, if we're talking about treating something chronic, we recommend that you treat daily for the first month or so, and then you can start skipping days. The good thing about Alpha-Stim is that it has a cumulative effect. So the more you use it, the better results we expect you to get, which makes it really nice too.
So what type of people should use this? Because what you're telling me is that it seems really, really like a cool and great idea, a great alternative. But like you mentioned, I did have someone on before, Tracy Austin, and we talked about mental fitness and how they do the whole thing of mapping or checking out
brain mapping and neurofeedback,
exactly.
biofeedback.
But people get nervous when you start talking about the brain. So what type of people should use this, and how would you react or respond to that?
Yeah, so again, I always try and give context around what Alpha-Stim is doing. So when you understand that our bodies operate electrically, it makes it a little less scary, right?
Right.
And we're not talking about electric shock treatment. If that were the case, I wouldn't be sitting here this tuned up right now, calmly speaking. It's emitting a very, very small amount of electricity, just enough to speak to our cells to tell them, hey, you need to do this a little better, or do this a little less, and do this a little more. Again, when we first got this device, my daughter was 11. So there's no way I was going to put something on her that wasn't safe. Again, Alpha-Stim's been around for 40 years. We have over 140 studies showing its safety and its efficacy, including places like the NHS in the UK. They've done a large study with Alpha-Stim looking both at safety and efficacy, but they also looked at whether it could save them money, and it did end up saving them money. And so now Alpha-Stim is one of the recommended therapies to use for their residents who are suffering with anxiety.
So, Mrs. Will Dees of Alpha-Stim, if you're sitting here saying, boy, this is really interesting and it has caught my attention, that is the goal because we look for alternatives. And the first question, and I know you've had this asked before, why haven't we heard about this before now?
That's what I was saying when I found out
Yes.
about it, because my daughter was sick for over a year before we
Wow.
found out about it, and I kind of stumbled across it.
Mhm.
Very thankful for a local dentist is actually who recommended it for my daughter because he was using it in his practice, and we started using it with her. So the thing is that, anytime you're introducing something that is different than what has been known as the status quo, you're going to first have to educate, and people have to be willing to have an open mind. So fortunately, we're getting there. I mean, we do more than half of our business with the US military and the VA. So
Wow.
that's fantastic. I
Yeah.
mentioned the NHS in the UK. Again, fantastic. We hope that we can get some more adoption here so that we can get more coverage with insurance and Medicare and things like that. But we're coming along. Things are changing. I think um, as as things progress, people
Hmm.
are looking for options, and that's what you're doing here, giving people options. And I
Yes.
work with a wide array of local traditional doctors and integrative doctors who have been open to Alpha-Stim, so they use it in their practice or they refer their patients to me. So we're going to get there.
Well, I really like the concept, and clearly, the stories that I've been covering, and so much is said about mental health and mental fitness. The
Mhm.
market right now, or the need, let me say that, in
The
a
need
more
is there.
yes, in a more genuine way. The need is there, and people need to know about this. So I'm happy, really honored that you agreed to come on and share this information because I know some people certainly that should at least investigate and entertain the idea. So how do they? Looks like you got another thought you want to
Yeah,
share.
so I just wanted to tell you, so one of the great things about our technology, we have so much confidence in its safety, its efficacy, that we offer a 30-day money back guarantee. Not many
Wow.
places offer that. Not if you try another type of therapy or medication or whatever. When my daughter was sick, I think we went through 20 different drugs. I wish we could have gotten a money back guarantee because we spent a lot of money on the stuff we were trying on her. So
Well,
with that, I always tell people you have very little to lose. We have a small restocking fee. If you find out that Alpha-Stim is not for you, I take pride in the work that I do. And so I partner very closely with all of my clients to ensure that they get the optimal support and optimal results with Alpha-Stim.
so as we start to wrap things up, can you show us the device once more and kind of walk us through how it actually works one more time?
Yep. So it's really easy. And again, you don't tell it to do anything. So you plug these in. We have a special conducting solution that helps conduct the current. You basically find your level that's comfortable to you. So I can go up and down. You don't have to be uncomfortable to treat with Alpha-Stim. So I'm at a comfortable level. And based on that level, you determine how long your session is. And so there's no issue with addiction or overuse or anything like that. I plug it in, I set my time. You can see that the timer is counting down. When the timer is finished, the device turns off and you're finished.
And so that one
So
is for that you're using right now is for anxiety.
anxiety, insomnia, depression. So that's our model 8. We also have another model that's called the model N. It's a little bit bigger. It does the exact same thing as the Model A that I have on. The difference is we have accessories such as these smart probes that treat pain. So rather than using the ear clips to disperse the electrical current, we use these probes, and you can situate these probes in a manner so that the current is going through the area of pain. And then you
So
also finish up with ear clips when you treat with that.
that sounds amazing and something that I know some people are certainly interested in. So how do they get these devices or find out more? I've got the website up, but give out the website information and what's needed.
Yep, the website is alpha-stim.com. It is a prescriptive device per the FDA, so it has to be authorized by a licensed healthcare practitioner working within his or her scope of practice. If for some reason you're interested in Alpha-Stim and you maybe don't have time to go to your clinician, or you don't feel as though they would be open to researching it, we do partner with a telehealth organization as well. So you can get connected with them through alphastim.com. I'd love to talk to anyone personally who just wants to chat about Alpha-Stim. You could call me about getting an Alpha-Stim as well. So you have several options.
Well, and I guess just put your information up, 704-969-9972, extension 701,
Exactly.
and Will at alphateammedical.com.
That's correct. That's my email address.
Yeah, this is a cool device with a cool system with a really cool name.
We're changing lives all the time.
Yeah.
And I call them paychecks of the heart, because I have so many people that I've introduced this device to, and they've said it's literally changed their lives. And that's what keeps me going.
Well, we appreciate your heart for serving others and for changing lives. Certainly appreciate it, Miss Dees. And I, again, am grateful for the opportunity for you to come on and share. And to our viewers, I would say, make this call, check into it, because that's what we're looking for, options. We respect science. This is based on science, not taken away from anything else. But one thing we've learned is people do prefer to have choices.
I'm sorry. And just one last thing I'll say.
Okay.
So if you choose to go with Alpha-Stim, it's not a medication or Alpha-Stim or different therapy or Alpha-Stim. Alpha-Stim is safe, and it plays nicely with medication if you choose to try medication, stay on medication, or whatever. So it doesn't prohibit you from doing other things. So I just wanted to mention that, because some people, I think, are afraid to get off their medication because they, that's their kind of safety net, and that's fine. We'll work with you regardless of what else you're doing.
Well, again, thank you for joining us, alpha-stim.com, or you can reach out to Mrs. Dees, again, 704-969-9972, extension 701, or hit her up on the email, will at alphateammedical.com. Thank you again so much for taking the time to talk with us.
Thank you, Tanya. I appreciate it.
Oh, I appreciate you. And that segment was pre-recorded because Miss Dees, we had to get her on, but some great information to share with you. And of course, our time is up now, my friends. I appreciate you all taking the time to join us. Alpha-Stim.com, an alternative choice that you may have that you might want to check into. I had heard absolutely nothing about it, but I do appreciate you joining us each and every week. We couldn't be here without you. Thank you to Mecklenburg County Public Health for their support. MECNC.gov, MECNC.gov, 980-314-9400. We're also appreciative of Groundwater Solutions, groundwater-solutions.org. 704-596-0505. You can catch me on Saturday. I see you guys are starting to make a couple of comments. Jacqueline Hill says it's interesting. It is interesting, an interesting device. And again, we provide real resources, just real talk about some of the things that you want to hear addressed that you don't always hear about. But again, my time is up. I appreciate you as always. Please share, let people know that we're having this conversation. And you can join me on Saturday, Sounds of Inspiration on Praise 100.9 FM. I'd love for you to tune in. I'm on from 10 a.m. until 2 p.m. And email me if you've got something you want us to talk about. rivenstanya@gmail.com. That's rivenstanya@gmail.com. And one more quick reminder, as I know COVID is starting now to die down and we feel like we're in a good position again and we're heading in that direction, and I'm excited for that, but we can't lose focus that we'll be dealing with this for quite some time. And there's an interesting report about the impact of COVID-19 on low-income households in our communities right here in our state. We're going to get those experts on to talk with us as well. We've got a lot of great stories still to come. Make it a great day, everyone. I certainly appreciate you, as I keep saying. Thanks for working with us, as we know that together, as we continue to work, we plan on canceling COVID. Have a great day, everyone, and thanks for tuning in.